Hello guys, this is Indian Medico, and in this video we are going to discuss about intracorneal ring segments. Intracorneal ring segments are abbreviated as ICRS. They are also known as Intacs, Kera rings or Ferrara rings. They consist of thin arc-shaped segments of polymethyl methacrylate of varying diameters and arc lengths. This picture shows intracorneal ring segments inside the eye of a patient. Now let us discuss the mechanism of action of intracorneal ring segments. Addition of tissue, that is the rings, to periphery of cornea causes flattening of central cornea, leading to myopic correction. As you can see in this picture, the intracorneal ring segments are placed in the periphery of cornea. This causes flattening of the central cornea, leading to reduction in myopia. The effect will be more when we use thicker rings, longer ring segments, and in case of more centrally placed segments. The channels for rings are made with special refines or femtosecond laser. If you use femtosecond laser, it will be more precise. For the treatment of myopia, we can use two symmetric intracorneal ring segments, and for treatment of keratoconus, combinations of different intracorneal ring segments are used. Now let us discuss the advantages of intracorneal ring segments. They are reversible, titratable, and no corneal tissue is removed in this procedure. Coming to the disadvantages of intracorneal ring segments, they are less predictable than excimer laser techniques. There can be complications from surgical placement of these rings like anterior chamber perforation, infectious keratitis, intracorneal ring segment extrusion, and corneal thinning. If you have any suggestions, please let me know in the comment section. For more such videos, please check out my playlists. Thank you.